Ayurveda has seen this as understood this or interpreted these 5 elements in the form of majorly 3 functional principles in our body. That is the Vata, the Pitta and the Kapha. When you learn a Vidya, when you learn Vidya, my husband always says this. It is very important when to present it, where to present it and how to present it. That is the real skill which we need.
Hi, welcome to KC Talks. In the series of podcasts on health and integrative medicine that we are having with Dr. Nirlepa ji, today we will be discussing about pulse and its characteristics. Namaste, madam.
Namaste.
So, the last podcast you gave a summary on body-mind interconnection,
Yes.
and a lot of information was there.
Yes.
So what is it that we're going to be discussing today?
So let us once summarize what we have seen or what we have talked about before we proceed further into the pulse. So we have understood that the whole world, the creation which we are seeing, is majorly made up of 5 elements. And Ayurveda has seen this as understood this or interpreted these 5 elements in the form of majorly 3 functional principles in our body. That is the Vata, the Pitta and the Kapha. And we have also understood that it needs to be in accordance with our constitution that we call Prakriti, as we are made up of it. As long as the Vata, Pitta, Kapha are in balance or in accordance with our Prakriti, we are in a state of health. When it gets disturbed, then the imbalance starts. We have also understood that there is a small basic qualities when the Vata is aggravated and when Vata is ameliorated or it is reduced to its natural state. So this was a superficial outline which we had given to just understand how our body works. Now each dosha has its gunas, has a quality. Again, each dosha is divided into 5 sub-doshas.
Okay.
Vata has 5 sub-doshas, Pitta and Kapha. All. So totally we have 15 sub-doshas working. Again, that division is mainly based on elements.
Okay, so we have 5 elements and we have
Yes.
3 doshas. 5 into 3 is equal to 15.
15, yes.
So every Vata will also have all the 5 element doshas.
Yes. It is called sub-doshas.
Sub-doshas.
Each has its again own seat and each has its own unique function to perform. Now, the body which is functioning here is a combination of these doshas.
Okay.
We cannot easily say that there is pitta aggravation. You have a stomach problem, there is pitta aggravation, so I'm going to give this. So it is more of interconnection that is happening here.
I want to ask you a question, ma'am.
Yes.
So as you have told us that 3 doshas and there are sub-doshas.
Yes.
So when you touch an Naadi of a person, will you tell the Vata is in the air or Vata is in the fire element of the body or in the space element of the body? You can understand that.
Yes.
Is it?
It is not like Vata is in the air or in fire. Vata in Vata element, what kind of Vata dosha, because of which element imbalance it is disturbed.
Okay, got it. So this is a right understanding.
Yes. So there is each subdosha is again related to one element. I can clearly explain this with a simple example. In the stomach, we have the digestion.
Yeah.
So there, generally when we talk about a stomach, we think that it is Jataragni. That is the subtle part, the fire which digests the food. But along with that, there is one kind of pitta called Pachaka pitta, which helps to produce the HCl, the enzymes. There is Samana Vayu, which balances this pitta and helps in digestion. And there is again Kledaka Kapha, one type of kapha, which forms the mucus lining of the stomach and sees that it does not disturb. So 3 doshas are being participating in that functioning of the stomach digestion at the stomach level in these levels. So we have to check.
You have given some new names to this Vata Pitta Kaphas, no? What kapha?
It is not new name. It is the subdivision, sub-dosha's name. Vata is of 5 types, as I have told. out of this, one of the vata is called samana vayu.
Oh, okay.
So what I basically want to convey is it is a combination of doshas where the functions are performed.
Super.
We cannot say that vata is only related to colon, and we can't, if there is a disturbance in the stomach, then there is no vata working.
Got it.
So it is a combination and interconnection of these doshas, which is basically based on the guna. Vata is light in nature, vata is cold in nature, and then vata is fast, it moves. So these are all the qualities which we have. So when we see pulse, or when we have to understand where the problem is, we have to understand the interconnectivity and see exactly where the imbalance is there.
Got it.
So what we have discussed in the previous podcast about vata being high and giving some features is a very superficial and basic knowledge which I have shared.
I got it. One in a digestive example, you have told us various names of the.
Yes. So there are
many subsections is what I have understood.
Exactly. Yes. So we have to, when we see a pulse or when we see a body, we have to understand the whole interconnection, and then based on that we have to interpret and understand.
Super.
So this is what we have seen till now, and all that I have spoken about now mainly belongs to visible spectrum, which we call as sthula jagat in Sanskrit. But there is also a force, a sustaining force, which maintains, which destroys, and which also operates this sthula jagat or this visible spectrum, which we call as invisible spectrum or sukshma or karana jagat.
Okay.
Let us understand this by the example of human only. Let us consider human being. Now, in human being, the body which we see, the body which functions, comes under sthula sarira.
The visible spectrum.
Yes, that is what is visible spectrum. The energy, the mind, the other force, the other sustaining force comes under the invisible spectrum,
emotions,
which we call as sukshma sarira and karana sarira.
Emotions also come under.
Yes, they also come under sukshma sarira.
Got it.
See, we want to move from one part to another. I want to move from one place to another place. First, the ignition comes at the mind that I have to move. Then our brain starts producing the transmissions, and then our muscle and we start moving.
Yeah.
It just happens so fast that we hardly notice it. What happens and what does not happen. So any governing principle or to the body that has to move or has to perform any function starts from the invisible spectrum. That is from the sukshma and karana sarira.
So actually everything originates from mind.
Mind and the other subtle bodies which we have. So the main is, they all are very interconnected. So it is very important for us to understand that this invisible and visible spectrum is interconnected, and it is the invisible spectrum which sustains the physical spectrum, or the sukshma and karana sariras sustain the the sthula sarira.
Very nice. Actually, this analogy gave me a new doubt.
Yes.
That how the body is sustained by an invisible spectrum. Like all the sthula jagat, this visible world also is sustained by an invisible spectrum, right?
Yes. Yes. And we can divide it broadly into living, the moving, chara and achara. There is living and non-living. And we say that living has life and non-living don't has life, but it has life at a very latent stage. But this completely deviates into a different topic. So let us stick to our body to understand how it works.
Yes.
So this is how the sukshma, karana and sthula are connected. Now there is an interjunction or a junction which transmutes all these, the interconnection.
Okay.
Now any change which happens in the sukshma sarira is felt through biorhythms which flow through the nadis. And these nadi are in correspondence with the major arteries of our body.
Okay.
So any change that is felt in the biorhythms is reflected on the body through these nadis.
Oh, okay.
There are majorly 9 sites in our body where we can understand this pulse. One of the major is the radial pulse. There is also temporal pulse where we can see on the temporal region. There is at the neck region. There are many other sites.
Then why of all the regions you chose this
Because
radial
this is
pulse?
most convenient, and it gives us the more information which is there. As long as you are it is easy to connect all the three. We have to, because we have to see many parameters in pulse. It is not just that we are seeing only one, which we will be discussing as we go further. But it is, radial pulse is the most convenient and easy way to express or to understand. That's why we chose this. But when the patients are in different conditions like coma, we have other choice also.
Okay, great.
Yes. So this is the 9 sites which we are speaking about. Now, I would like to ask you a question. When you see an ECG with the graph, what do you feel about it? How do you feel it? How do you interpret it?
Whether it is normal or the rhythm is good or it has.
Yeah, when you see that waves written on it, so how do you feel it? I mean, when you see it, what is your explanation about it?
The waves up and downs, and
Yes.
it shows as a rhythm. If the rhythm is in normal pattern, then your ECG
That
is.
you can understand by seeing an ECG? As a yes,
as a
I want to know
common
that.
man, I
Yeah,
can't
yeah.
understand it, but there is.
So
The doctor
similarly,
can.
when you see a pulse, a trained person can interpret it. Just like a trained cardiologist can understand an ECG. For a common man, it is just a small waves which is going on, or a patterns which is repeating. But when you are trained in it and when you understand it, we can get many interpretations, or we understand many functionings of the body.
Great.
Similarly, training of the pulse helps us to understand many factors of a body and mind and spirit.
Superb. So I can interpret it like that. So when you touch a pulse, you see like how a doctor sees a ECG wave. Like that, you get to see a
Exactly.
biorhythm wave.
Biorhythm waves which is affected through the nadis, and that pulsations and in the form of waves we interpret.
Super. Crystal clear now.
Yes.
I got a clear understanding of what you're dealing with.
Now the pulse, it has 7 characteristics, majorly 9 characteristics. I would cite some examples to understand. Generally, when an allopathic doctor touches the pulse, they generally see the vega, which we call in Sanskrit vega, that is
Fastness.
the rate,
Rate.
pulse rate. How much time per minute there is heartbeat, all the pulse that is running in. So it is only one feature of the Naadi Pareeksha. The vega depends on the constitution again. Vata has a bit faster rate. Pitta is slower, comparatively slower. Like Vata will be at 90 or 100 generally. If a Vata dominating person has higher rate of 90, pulse rate of 90, we do not think he is having a disorder because it is nature. Pitta pulse is a bit slower compared to Vata, and Kapha is even more slower, more like 60, 70, which varies between 60 and 70. So also this vega is varied with metabolism. If your metabolism is high, your pulse is higher. If your metabolism goes low, it indicates that you are having lower metabolism.
Oh, okay.
It also varies with the age. And there are many factors which the vega determines. So first characteristic when we see a pulse is how much is his rate. Next is gati. That is how the wave patterns are. This is a very wide sphere where we interpret different types of nadis. The basic qualities of Vata, Pitta, Kapha are explained in the texts are Vata gati is more of Sarpa gati.
Like it moves like a snake.
Like a snake. It is not more deep. It just swiftly moves. And you press it, when you try to see it more keenly, it just escapes. Pitta is more of Manduka gati.
It jumps.
Just like a frog.
It jumps.
Yes. And Kapha is more like Hamsa gati.
What does that Hamsa do?
Hamsa is swan.
And how does it go?
It goes just like it goes beautifully harmoniously on a water. It's not neither very fast nor very, very strong. It is just like a wave which goes on, like swan goes on a water.
So all the three.
So this is a balanced Vata, Pitta, Kapha pulse.
Yeah.
As it deviates, the gati changes. And with the change of gati, we understand the deviation of Vata, Pitta and Kapha.
Very nice.
Then we have Tala, that is the rhythm, where the pulse rate sometimes the pulse miss. There is after every beat, the beat should be in the rhythm. If there is any irregularity, if the irregularity is irregular or regular. So these are the next features we go in.
Okay.
Then there is bala, the force with which the pulse is, the beating. That also plays a very important role to understand. We have akruti, the volume and the tension of the pulse. This helps us to understand the blood pressure of the patient. Now, this is a very interesting thing. When you have, what we do is we see that our blood pressure is high in a BP machine, and then we try to manage the blood pressure so that it doesn't cause any harm to other parts of the system. Because high blood pressure also causes, if it is maintained in that level only, then it will cause an issue to other systems of the medicine, of the other systems of the body, which is not accepted.
Okay.
But at the same time, it is equally important to understand why the pressure is high and deal with it. Now, this blood pressure, when you take a medicine and when you come, though it is managed at the reading level or the superficial level, at the artery level, still in the pulse, we can understand if there is volume and the tension in the vessel.
Very nice.
And even for some persons, the high blood pressure is not manifested. But in the akruti and bala, by seeing these two, we can understand that the pressure is rising high. Soon it will be manifested in the form of high blood pressure.
Oh, so you can predict what can come in the future.
It's not future, it is just that it is about to manifest.
Right.
So the body indicates at the Naadi level, because the manifestation, if it starts from the mind to the body, then it would be first known in the pulse for sure.
Very nice.
So that is how we when we see a pulse, we not only see the rate, we see all these features, and we have to interpret based on what these three doshas and all are working.
So you have said about 5 characteristics.
Majorly 5 I have told. There is Katinyata, the vessel, how the vessel is. Then there is Tapaman, there is heat. So there are many other features to
total 9 you are telling.
There are more of 9, yes. So majorly we can understand these first. We give first preference to these things. So
very nice.
This is the majorly in pulse. These are the major characteristics of the pulse.
So I would elaborate now for common audience to understand. So you have Vata, Pitta, Kaphas. Then you have all the 5 elements.
Subdoshas.
So
in
total
each
15. And out of this 15, again there are 9 characteristics how the entire pulse is manifesting. So this entire combination gives you a spectrum of understanding. This gives an elaborate spectrum to understand what the patient exact situation is.
Yes.
Am I right?
Yes.
I've understood it right?
Yes.
Superb, madam. Thanks for simplification.
And this is actually, in Ayurveda, there are majorly 8 diagnostic tools. Naadi Pareeksha is one of them.
Okay.
There used to be urine examination. There is stool examination. There is auscultation, that is sound through Sabda, which is there even in allopathy. They also, when we go for a clinical assessment, auscultation plays a very important role, for which they use a stethoscope.
Okay.
Then there is percussion and palpitation, where we touch your abdomen. That is also there in allopathy and even in Ayurveda.
Okay.
And then there is tongue diagnosis. So in Ayurveda, they see a person as a whole. Through 8 diagnostics, they used to see to understand what exactly the dysfunction is. And one of it is Naadi Pareeksha.
So you are specialized in that?
I have chosen that diagnostic tool because it let me understand the manifestation before it happens in the body. See, after the pathology is happening and then giving it a name does not only finish our work.
Okay.
We are not here to give a diagnosis. Diagnosis is important, but equally important is to understand why this is happening.
The cause.
Why? Yes. What is the process that led to this? For that, pulse is very important. And it plays a very important role to understand that in a very practical way.
Very nice. Very intelligent, holistic way of dealing with the body. So even something translates onto the body, you can figure out that things can go wrong with this person.
Yes. Because it is expressive in that. So we can see both mind and body through the pulse. which we will discuss, like what exactly in body features we can see. There are 7 levels. There are further more to this. But it is very important to understand. And when you learn a vidya, when you learn vidya, my husband always says this. It is very important when to present it, where to present it, and how to present it. That is the real skill which we need.
Makes a lot of sense to me.
Because we are sitting in a place of doctor, and as a doctor, I have to be a well-wisher. I have to think about the wellness of the patient. Sometimes the patient himself will not be in a state to think about his wellness. But when he comes to me, I have to understand his wellness, and I have to tell him what to be done to retain his state. It is not an exhibition of my art or my knowledge that I start reading his all his features that you have, because I can interpret it. My husband explained this with a very good example of Lord Krishna. Lord Krishna knew the philosophies or the whatever, the Gita he spoke about from the beginning, or from, he knows everything.
He's a god, so he knows everything.
He knows. But he didn't exhibit it or spoke about it every time or whenever as an exhibition. He spoke at the right time in the right way to the right person.
And his right state of mind also.
Exactly. So he said, and that's why that showed so much of impact. Till now it shows the impact.
Yeah.
Because it was put in the right way. Similarly, when we are in the doctor's state, we have to understand the patient. Because after seeing podcasts, many patients tell me, now you tell me about the mind. Come on. Yeah, because that is the taking of the person. Because you can read it, you just let me know. But actually, we reveal it with time and with the the interaction with the as we go on with the
closeness and the relationship that you develop.
Then the patient, for some patients it is important that we reveal this at the starting part. So it is a very individualistic and decisiveness. We have to be very clear whether we have to speak it or not, and that is what the main sutra is.
This is called a wisdom
and
a maturity in dealing with a patient.
Yes.
You can't just tell him anything, and then that will create an anxiety in him.
Yes. We should not do anything that will disturb his state. But at the same time, it is equally important to tell him if it is causing a danger. I also had this experience in my during COVID time. I told them that this would be really, you have to be isolated because it's important that you are, though there are kids, or you have to take care of it. But they felt it that I am trying to scare them. But where it is important to tell, we have to tell where there is no choice. But where it is not necessary, we will not say it. So it is that you have to understand when we are in the
same way you touch the Naadi of a patient, you will only reveal what is necessary needed at that point of time to that person.
And as we progress, we will definitely tell you what to do and what not.
Very nice understanding, ma'am. I'm so impressed with your... definitely, it's a complicated process. It is not as easy.
Yes.
Because once you touch a pulse, then your mind starts thinking so many parameters. So, which I can relate to. And tools of diagnosis that you have told is also very, very impressive. And the way you deal with the patient. So, I can definitely name this as an holistic treatment. Yes. Thank you so much for your beautiful insight, ma'am.
Namaste.
Namaste.